Hello and welcome to Round Robin. I'm your host, Robin McCormick with the City of Hampton. And today we're going to address a topic that isn't necessarily fun, but is very, very important to all of us. And that is an advanced medical care directive. We need one, we'll be glad we have one, but it might be a little rocky getting there. And our guests today are going to help us through it. My guests are David Murray and Susie Castle. And you're with Peninsula Agency on Aging, and you are with I'm going to not get the name right, but a regional cooperative designed to help people through getting this process and making sure it's communicated to all the parties it needs to be communicated to. Is that fair enough?
That's right.
Okay, let's start with why is it important? Why do I need an advanced medical directive? And especially, why does a 25-year-old need an advanced medical directive? Who does and why?
Well, a 25-year-old will need it because accidents happen. Advanced directives are often thought of as being end of life when someone ages and their wishes that they want for the treatment they would receive, if necessary, should they not be able to communicate. But accidents happen, and we see that all too often in the news. It's usually somebody young who has been in some unfortunate circumstance. And the question is, what kind of care would they have liked, because they have not completed an advanced directive. So really anyone 18 years of age or older ought to have this and understand what the circumstances might be for life-sustaining treatment should the serious illness or injury affect them and they not be able to communicate their wishes to their treatment, their physician group.
And things may change. Your needs and desires may change as you age. You might, when you're young, want a whole lot of measures taken because I'm young and I'm strong and I can bounce back from it, or whatever those circumstances might be. And if you have other medical conditions later, that might change the picture, or it might not. Your religious beliefs might change, your philosophies. I mean, it's something you should probably also revisit, not do once and put it away.
Correct, and many people feel that way, that it's something they write once and they put in their safety deposit box or somewhere it's not supposed to be, and they're done with it. But you can write an advanced directive and change it in 30 minutes or 30 days, but you do have to revisit it and make sure that the healthcare agent that you've named
is still able to perform the job and still the person you trust.
Correct, or there may be over time breakthroughs in medicine that would want or inspire you to change your life-sustaining treatments based on what's available at that point in time. So it's not a one-and-done document. It's one that should be revisited over time, but addressed early in life.
Now, I will say, when I had this done a few years ago, I had to hire a lawyer. It was a little bit pricey, and it was kind of a complicated process. And not that isn't what some people need based on complicated family structures, but you guys have really simplified how people can do this without having to hire a lawyer.
Well, actually the instruction for completing an advanced directive has been simple for a long time, but what is not commonly known is that to complete your own advanced directive, you do not need an attorney to do that. An attorney will usually help you with a living will and a medical power of attorney.
Right, mine was a combined.
Right,
Yeah.
and both those components are in a Virginia Advanced Directive for Healthcare. Your healthcare wishes are listed, as well as your healthcare agent, who is that medical power of attorney. But it costs you nothing. So if seeing a lawyer is cost prohibitive, or you want to change it frequently, you can fill out the advanced directive by yourself and register it by yourself.
So how do I do it? Let's assume I'm watching and I think, okay, I'm ready.
Well, I guess the first thing I would say is go to our website, the coalition that I'm involved in, which is the Advanced Care Planning Coalition of Eastern Virginia, has a community brand called As You Wish Advanced Care Planning. And the website is www.asyouwishvirginia, all spelled out, .org. And on the website, you can download the Virginia Advanced Directive for Healthcare. There are frequently asked questions and responses to those frequently asked questions that are there that help direct you towards the completion of the directive on your own. Now, our phone number is there. You can email us, and we can also provide guidance through that. And that, I think, really is the key, is that statistics have proven over 10 years that 9 out of 10 people believe this is important, that your wishes for your own care be honored should you find yourself in need of treatment and be unable to communicate. Yet less than 3 out of 10 people actually have an advance directive. And what our program is trying to do is close that gap between the appreciation of how important this is and the lack of action actually everyone takes by making this simple and creating that guidance so that people can do it on their own or contact us for some facilitation to understand what the document is and how to complete it and why it's beneficial.
What stops people? Why do people not take that step?
People are...
I'm laughing.
You've been through it with folks.
Yeah, Susie, go
People
ahead.
plan more for a birthday party or an anniversary than they do for end of life. They don't want to think about end of life.
It's not a pleasant
It is not, but it's very,
topic.
very important.
And it's personal.
And we're going to get there, though. You know, it's not like by not thinking about it, you're delaying your own death. You're not.
Absolutely.
Correct.
In fact.
And a lot of people feel that. If I bring it up, I'm going to accelerate my aging process or my illness process, which is completely false. But it is really incredibly personal. And in most of us, once we become adults and we're independent, we're in control, why would we relinquish that control over the kind of care we get when we can't communicate ourselves? So this document basically says, should this happen, this is how I would like to be treated, as opposed to it's anyone's guess, which complicates things.
So, Robin, I'm out in the community all the time meeting with folks, and if I'm interviewing a senior, because I do work for Peninsula Agency on Aging, and I will be talking to them about services available, and one of the questions that's on our form is, do you have an advance medical directive? And I don't know, I think the people that I see, it's more than 7 out of 10 that don't have them. But I encourage them to consider that option and to plan and to designate what kind of care they want. And you said, why don't they have it? I think a lot of people just, of course, they don't want to think about end of life, but they're also afraid that if they designate someone to be someone who makes decisions for them, if they think that they're not able to do so, they're afraid it goes into effect right away. They're uninformed. They don't understand that as long as they are able to make those decisions for themselves, they are still in control.
So conscious, sound mind and body, it's all my decision.
As long as you can make the decision yourself and you're of
And
sound mind
communicate it,
and
right.
communicate it. This
Correct.
is something that comes into play when you're unable to communicate. I don't know if Dave wants to go into specifics of cases, but I know I've heard him say, and currently, Bobby Christina, they put her on life-sustaining equipment because
not
there
an
is
elderly person either, someone who wasn't.
and there
choosing
apparently is some kind of confusion about who's in charge, because clearly there was not an advance medical directive. So you don't need to wait until you're 60 years of age. That'll be when I ask you if you have one, but younger people need to consider this as something that's important. And I have an advance medical directive. I also have other legal documents. I have 3 children. I have 1 child that I have designated for this and have discussed with that child what my wishes are. I hope she never is put in the place that she has to do this. But you know, they always say if you're prepared, then perhaps it won't be ready, something that you don't need. And if I do need it, I know it's in place.
Well, now, Susan, you mentioned too discussion. And let's get to that point, because I can fill out all the forms and register them, but if I haven't talked to the people who are my legal next of kin and the person, if it's different, who I have designated, you know, and I'm in the hospital having surgery and something happens, there's a mess going on.
And I've seen that happen so many times. I've seen someone designate an individual as their health care decision maker, and then when something came up, that they contacted that person and they said, well, I had no idea. I'm not in a position to make that decision, and I'm not going to make it. She had never discussed it with that person.
Yeah, some people don't want that responsibility or have conflicting beliefs. If my religious beliefs don't allow me to follow your wishes, you need to know that up front.
And that's why your selection of your healthcare agent has to include that discussion. It's one thing to document your wishes, and then it's to share it. And the individual you name as your healthcare agent may not necessarily subscribe to what you would want to do, but if they will honor those and be an advocate and represent your interests at a very difficult time, then that's the agent you really want to select.
And by having that discussion, that person understands. Certainly the form really helps, and it's very specific, and it'll say things like never a ventilator, or a ventilator, I can go on a ventilator if there's a reasonable chance of recovery, or, there's a lot of variations on there, but if you have the discussion, you get to a better understanding of what your person wants and what the circumstances might be, and you can cover those gray area and nuances, and you're better able to act on their behalf.
So not only having the discussion, but also having the document where people can find it. Does your healthcare provider have the document? Does the person, if you have named someone, do they have it? Or is it locked in your safe deposit box so when you have that emergency, nobody can get to it and nobody knows?
And don't assume that if you've given it to the hospital once before, that it's still there when you go in for your next surgery. My mom found out that last week. You've got to have a copy with you for any known medical procedure, and you've got to make sure that other people have copies that they can get to just in case.
That's correct. And the most important now with electronic health records, which might prevent people from having to carry it all the time, is if it's in your electronic health record, the hospital should be able to pull that up, read your wishes there, and not ask repeatedly for the actual document, but at every stage within the hospital, find it that way.
Is that, I know we have, you represent 4 hospital systems that are in this collective, and can they all access the same set of records if you've given them permission to as a patient? Or are we not quite there yet?
We're not quite there yet, but we are talking about that, and that is in process, which will benefit everyone in the Eastern Virginia to know that if you are not at your hospital of choice.
Because you might not be in an accident or an emergency situation.
Right. But if the advance directive comes into play, that it can be shared across systems when seconds are counting, and the medical team needs to know what to do.
Okay. Well, let me just ask if you were working with someone in your own family to fill this form out, either your form or their form, what are some tips you might have for people about how to discuss a topic that people may not want to discuss? Do you want to do this? I know you work with folks specifically.
As I said earlier, people don't want to talk about this, and sometimes an individual may want to talk about it, but when they approach their family about it, the family members don't want to talk about it. And so I think it's really important that the public is educated, that this is very important. It's very important for an individual to sit down with their loved ones and say, this is what I want. If this situation occurs, I want this to happen. And if you love me and respect me, then you'll listen to my wishes and then help me to make sure that they take place, that ensure that it happens. So I think it's up to the individual.
Somebody has to get it started, whether that's you meeting with a client, whether that's the son or daughter of that client or the spouse of that client, or anybody else in the family. Or maybe I get it started talking about me, and that gets my mom or dad talking about it too.
Correct.
I think many of the people who have them, or the few people that have them, there's usually a trigger. Something has happened in someone's life where they see that they would be a benefit to have their own advance directive based on something they saw occur, unfortunately, with a friend or a loved one. So we learn by mistakes, and I think a lot of people, that's really the trigger of the conversation, whether it's somebody young and in the news who we're talking about who clearly should have had one, or a family member who should have had one. Use the trigger as a way to enter that conversation. But as Susie said, it is very personal, and it really that's a personal responsibility to start that directive and then share those wishes with those you love.
That is good. And now you've made it very available on the website, free, and as painless as it can be to talk about that.
Another thing that we didn't discuss, but I want to make sure, you said that you had done yours with an attorney, and certainly that is still available to folks who want to do
absolutely.
it. But all that is required is that you have 2 witnesses over the age of 18 to witness the document as you sign it. It doesn't have to be notarized, and it does not, in Virginia, it does not have to be done with legal counsel.
So those rules have really simplified to make it more accessible to people. I guess the state
It is simpler than we have
realized.
understood it to be, and that's what we're trying to do is again, address that gap in guidance through education and facilitation of the conversation so that everyone can protect themselves with the directive.
Okay, well, that sounds great. I'm going to have you repeat the website one more time where people
Okay.
can get this form.
It's www.asuwishvirginia.org, with Virginia spelled out.
All right, and if you're on the peninsula, I'm going to say your agency can also help, because some of the folks who watch this show don't necessarily have internet access and might need might need that printed form given to them.
We can print it out and mail it to them along, and just this week I've done that. Went to do an interview. She didn't have the internet, so I printed everything out when I got back to the office, including the general information that Dave mentioned about frequently asked questions, and as well as the form, and mailed it to the individual so that she and her family could review the information together.
Wonderful.
We're happy to do that at PAA.
Okay, so you guys have taken the hard part out of it. It's just we all need to face it and to talk about it and deal with our own mortality, because we're not going to live forever. None of us is. We're going to go at some point.
That's a shared experience.
That's right.
It's best to be prepared.
All right. Well, thank you, Susan, and thank you, David, for coming by.
Robin.
It's an enlightening topic.
Thank
And
you.
thank you for watching. I hope you will be able to face this with your loved one or trusted friend or whoever you feel comfortable with, and get over the process, fill out the form. You can always readjust it. You can always change your mind, but better to be prepared than unprepared. Thanks for watching.